What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. As a fellow X-ray tech here, we're giving you the knowledge to prepare you for the field. So I work in the emergency room night shift. In today's video, we are covering the MVC protocol. So in case of an MVC, obviously if anything was like deformed or fractured, they will straight up just X-ray right away those parts. Like if an arm or a leg comes in crushed, it's straight up that. But usually, if there's nothing severely crushed, usually just the standard chest X-ray protocol is kind of where they kind of land. And sometimes they'll throw in a pelvis just to make sure that whatever's hurting is okay and it's not fractured. But usually, for sure, if nothing's fractured and there's nothing hurt with the patient, usually just the chest X-ray is kind of where they leave it at for the most part. Occasionally you'll have something crazy, and if they hit their head or got something hurt with their head, obviously CAT scan will be the higher priority versus X-ray, because like any brain bleeds or anything to the dome, usually always high priority, because that's on like a time window of, because you only have a certain amount of time before like a brain bleed can go really bad for the patient. So always make sure that you and the CAT scan always assess this X-ray text. You can quickly see if the patient has like something really bad with their head. Always wait. I mean, you can maybe snag just a chest X-ray, and then whatever else is going on, you kind of wait and back off and let CAT scan take over. So yeah, that's, I mean, for most car crashes, depending if it's something severe with their extremities, you might have to just do, like, let's say it's a forearm, you might have to just do like a PA instead of an AP forearm, and then kind of cross table will kind of vary depending on the severity. I've seen some pretty wild ones. So any car crash, motorcycle vehicle accident, sometimes them people don't come in the most optimal shapes, and it gets pretty, you got to get creative sometimes to get those images depending on how it's broken. Occasionally you'll have patients that like they'll be completely fine, they just come in just to get checked, and you know, for like either insurance purposes or just to be safe because of the shock. But usually just a chest X-ray for those. And yeah, it's been your boy Miguel. See ya on the next one.